To change the airway on the infant mannequin, first remove the face skin. Start by gently pulling the skin off of the attachment posts located under the jaw on the side of the neck. Gently curl the face skin upward and pull the skin up and from the head. Next, tilt the head back, loosen the jaw and release the tube end of the airway from its attachment slot and then remove the jaw. Now remove the chest skin by gently releasing it from the attachment posts located on the torso and shoulders. Lay it back to reveal the chest cavity and lungs. Gently unhook the lungs on the left side of the baby's chest plate and raise the chest plate to reveal the blue connector, taking care not to damage the wire connections. Release the airway from a securing notch on the baby's left side and remove the tube from the jaw. Lift the blue tab that holds the blue connector down and lift the connector upward to release. Exchange the old airway with a new one. Slide the tube end of the airway back up through the neck. Attach the tube to the jaw, making sure the tube has been properly slotted back into the jaw correctly. Then reinsert the jaw. Slip the airway into the securing notch and then reinsert the blue connector into its holder and close the blue tab. Lower the chest plate and secure the lungs on the attachment hooks. This is very important because it prevents the lungs from sliding off of the chest plate. Reattach the chest skin and reattach the face skin. Make sure that the airway's tube connector is seated inside the red mouthpiece of the face skin. To make sure everything is functioning properly. To change the airway on the adult mannequin, first remove the face skin. Start by gently pulling the skin off of the attachment posts located at the bottom of the mannequin's ears. Gently curl the face skin upward and pull the skin up and from the head. Make sure the red mouthpiece in the face skin does not remain attached to the tube at the end of the airway. Next, peel the neck skin back to reveal the jaw and remove the jaw by pulling up and away from the head. Then remove the airway connector from the head by sliding the connector horizontally towards the jaw to disconnect it from the head mount. Remove the chest skin by gently removing it from the attachment posts located on the torso and shoulders. Lay it back to reveal the chest cavity and lungs. Pull the airway tube down through the neck. To remove the airway from the compression plate, pull up on the white connector. After it pops loose, slide the short tube horizontally through the large slot of the compression plate. Then remove the exhaust tube from the side of the mannequin. Exchange the old airway with a new one. Slide the small portion of the tube into the slot and then press down until it clicks into place. Make sure the hole in the center of the lungs sits over the clear plastic ventilation sensor. Run the airway up through the neck and reconnect it to the head mount. Reinstall the exhaust end of the airway and fold the chest skin back into position, making sure the chest plate has been placed properly over the clear plastic ventilation sensor. As you reattach the chest skin, make sure it does not lay over the neck skin of the mannequin. Reinstall the jaw and neck skin. Attach the hair to the attachment posts and gently install the face skin to the attachment posts, making sure the red mouth connector is seated on the end of the tube connector of the airway. It's always a good idea to test the mannequin afterward to make sure everything is functioning properly. To replace the mannequin head, place the mannequin on a work surface with the head easily accessible and unzip the jacket. Grasp the face skin at the ears and pull outward to release from the attachment posts. Gently pull upwards to remove the face skin, taking care to make sure the red airway coupling remains attached to the face skin and is not still attached to the airway. Loosen the mandible gently by pulling upward and away. Then pop the airway loose from the holder with a motion toward the mandible. Next, release the chest skin from all 6 attachment posts on the torso and set aside. Remove the airway and set to the side. To release the head, rotate the head 180 degrees in either direction and pull. Note that the mounting post on the head has a key and that there is a receiving notch on the torso. Align the key on the head's mounting post with the notch on the torso. Place the new head facing backward. Gently push in, and then rotate the head 180 degrees to a forward-facing position. Reversing the instructions, install the airway and face skin. Make sure the red airway coupling clicks into place when connecting it to the airway. Congratulations! You've successfully replaced the mannequin head. To replace the To change the adult chest skin, unzip the jacket to expose the chest. Starting at the shoulders, gently pull the skin off of the attachment posts, working your way down the chest, one side at a time. Once detached, turn the chest skin over to remove the pressure plate from the skin, taking care not to pull the black wiring harnesses. Remove the pressure plate by gently pulling up the plastic frame and detaching it from the 4 attachment posts. Discard the old chest skin and pick up the new one along with a pair of needle nose pliers, which can be helpful in attaching the pressure plate. Set the pliers aside and position the new chest skin under the pressure plate with the attachment posts facing up. Then position the pressure plate and frame over the posts. Guide the attachment posts at the top of the chest into the appropriate hole of the pressure plate and pull it through with your fingers. Do the same for the other attachment post for the upper chest. The lower attachment posts can be more difficult to pull through, and this is where the pliers can be helpful. Guide the lower attachment post through the lower hole and then use the needle nose pliers to pull it through. Do the same for the remaining attachment post. Now turn the chest skin over, making sure the inflatable lungs are seated properly and that the pressure plate makes contact with the plunger. Once the skin is seated, start at the bottom of the mannequin and gently pull the mounting hole on the chest skin over the attachment post. Work your way up from the bottom to the shoulders. Zip up the jacket and you are done.